Hello everyone, today is August the 12th. I'm Dr. Adam London, Director of the Kent County Health Department, here for this week's COVID-19 update. Here in Kent County, we're currently reporting 6,919 diagnosed cases. We're seeing an average of about 36 new cases reported each day over the past week. So that number has come down a little bit. Last week I was saying about 50 new cases per day. This is a good sign. We're also seeing our positivity rate, that percentage of our tests that come back positive for COVID-19, continue to tick downward. We're currently at 2.2% over the past week in our positivity rate. However, it remains a concern what's happening on the other side of the state, where in the Metro Detroit area, they're seeing positivity rates range between about 4.5% all the way up to over 7%. That's very concerning because of the potential that has to influence the rest of the state's situation with COVID-19. We're reporting 5,598 recoveries to date and 153 deaths. We've had one additional death over the past week, and so our rate of deaths has continued to slow down. It's another very positive sign about where we're currently standing. Our overall case mortality is at 2.2% here in Kent County. That's the percentage of our diagnosed cases that have passed away. That number, as high as it is, and as high as the number of deaths that 153 is, and unfortunate, tragic as it is, it's actually much, much lower as a rate than what other places have seen. Currently, the statewide case mortality rate is 7%. So we continue to do very well here in terms of keeping the percentage of deaths very low. Getting asked a lot of questions right now about what are the big hurdles that I see going forward as we enter this next phase of this COVID-19 pandemic. And there's two things that I'm looking at right now that are concerning for us as we're planning for what happens next. The first is the changing weather. And as the weather cools down, we know that as the weather changes, people's behavior changes. We also know that many viruses have a seasonal effect to them, where they're more effective at transmitting during certain times of the year. And with COVID-19, because we've only really seen it for a couple of seasons, we don't exactly know how this epidemic is going to look season over season. So we're somewhat concerned about that. Certainly as the weather cools down, people tend to spend more time indoors. That's concerning. Also, less humid conditions tend to be a little more favorable to respiratory viruses. But we just don't know because this thing first arrived here in West Michigan, probably February, certainly March, but it really wasn't prevalent in the community until much later than that. So we just don't have much history with this virus in our community season over season. The other thing that is concerning that we're looking at very carefully that as a hurdle moving forward is the reopening of schools. Now, school is incredibly important to the well-being of our children and to our communities. And there are many different groups and individuals that are having a say in how this happens in a low-risk way going forward. Certainly students and families, teachers and faculty and administrators and the community and public health and so many others have a say that needs to be heard in how we do this in a low-risk way that balances all of the pros and cons that we have to think about when we're thinking about the wellness, not just of our students and our children, but of our community overall. Masks are one of the things that are commonly talked about, and we get a lot of questions right now about masks. So, right now, the requirements the state has shared expects all students from the 6th grade up to wear a mask while in school unless they have a medical reason why they cannot do that. Now, here at the Kent County Health Department, we support that. We also, however, recommend mask use for all students, kindergarten and up, in as much as possible, in as much as they can sustain that. These things are all very important for reducing the overall risk of transmission, both in the classroom, but also in the community. And as our students, our children, and our faculty in the schools go back to their families and go back to the rest of the community, it's very important that we're protecting them and that entire broader community. So we do recommend that everyone wear a mask in school in as much as possible. We also recommend, we know there are exemptions for those who are medically delicate and who can't sustain wearing a mask. As a public health professional, I recommend that if you have a child that cannot wear a mask because of a medical reason, or you're concerned about that, I'm going to strongly encourage you to think very carefully about choosing the virtual option. Now, this is a choice that you as a family have to make, but we have seen how destructive this virus can be to people who have underlying health conditions and people that we know are more vulnerable. And so if you have a family member, either at home or the student itself, that is really struggling with underlying health conditions, I want you and your family to think carefully about that virtual option, doing what you can to protect your child and also the family back at home. Certainly, these are difficult decisions to make. And we know that every family has their own priorities and has their own situations that they need to weigh very carefully. So again, we're recommending mask use for anyone in the school building, and we're recommending that if you do have either a student or a person in the home who's medically delicate, that has underlying health conditions, can't wear a mask, that choosing that virtual option may be the thing for you to think about. I want to end on a positive note. We're hearing that the U.S. has ordered 100 million doses of the Moderna vaccine. That vaccine is currently in phase 3 of its trials. They're doing this in optimistic anticipation that vaccine is going to be successful. And I want you to know that all of us in public health and in healthcare are thinking about and we're planning how we're going to make vaccine available in as accessible a way to as much of the population as possible once that vaccine is safely available to all of us. So we're thinking about that final end game strategy here with how we bring effective therapy and vaccine to the community. So we're looking forward to that. Stay positive. There is a light at the end of the tunnel with this. We are hearing great news about both that Moderna vaccine and other vaccines that are in trials. We expect that we're going to have something before too much longer, so there is reason to be optimistic. So stay positive, stay heroic, and stay healthy, and I'll talk to you again very soon.